Hi all, welcome to Physio Exam Buddy. This video is on the conducting system of heart. By watching this video, you will be able to answer the questions from these regions, that is parts of conducting system, origin of the impulse from the conducting system, and the spread of the cardiac impulse. Cardiac impulse originates in SA node. Presence of pre-potential or pacemaker potential is the underlying mechanism responsible for the self-generation of rhythmic impulses or autorhythmicity. And from the SA node, the action potential spread out the heart via a specialized conducting system of the heart, which includes internodal pathways, AV node, bundle of His, bundle branches, and Purkinje fibers. We will see in detail each parts of the conducting system. So first about the SA node. It is located at the junction of superior vena cava with the right atrium. SA node, it is the pacemaker of the heart since it has the highest rate of impulse generation, that is 70 to 80 per minute. SA node is composed of specialized cell which is known as the pacemaker cells or the P cells. They are small rounded cells of 3 to 5 micrometer in diameter, and they have only few organelles and almost no contractile elements. Gap junctions are present in these pacemaker cells. And the spontaneous rhythmical impulses from the SA node spread in all directions via gap junctions to atrial muscle fibers, through the internodal pathways to our AV node, and through the anterior interatrial band to the left atrium. So, from the SA node, the impulses can spread to the atrial muscles via gap junction and directly to the AV node via the internodal pathways and to the left atrium by means of an anterior interatrial band. Next, about the internodal pathways. It comprises of three bundles that connect the SA node to the AV node, and they are anterior bundle of Bachmann, this one, and the middle internodal tract of Wenckebach, and the posterior internodal tract of Thorne. The conduction is more rapid in these internodal bundles, that is around 1 meter per second, as they contain Purkinje type of fibers. That is the reason for the rapid conduction velocity of 1 meter per second. Next, about the atrioventricular node. It is located in the lower part of the interatrial septum, posteriorly and towards the right side. It is stimulated by an excitation wave through the internodal tract and the atrial myocardium. And from the AV node, the cardiac impulse is conducted to the ventricles by the bundle of His, which is the only conducting pathway between the atria and ventricles. The conducting system is organized in such a way that the cardiac impulse does not travel from the atria to ventricle too rapidly. So, there is an AV nodal delay. There is a delay in conduction from atria to ventricle, which is known as the AV nodal delay of 0.1 second. Now, we will see what are the causes for this AV nodal delay. Two reasons for the AV nodal delay is that first one is that AV node, it is made up of fibers of less diameter and there are only less number of gap junctions, and these are the two reasons for the AV nodal delay. And usually the sympathetic nervous system stimulation will decrease the AV nodal delay, whereas parasympathetic stimulation is found to increase the delay. And what is the significance of this AV nodal delay? This delay is the one which allows the time for atria to empty their blood into the ventricles before the ventricle starts contracting. That is proper emptying of atria and adequate filling of the ventricles occur. And another significance of this delay is that it limits the impulses that can be conducted through the AV node to about 230 per minute. This protects the ventricle from being driven at an excessive rate, which can reduce the pumping effectiveness of the heart. So it will also helps to maintain the effective pumping of our heart. Next, about the bundle of His. It is continuous with our AV node, and the bundle of His pierces the fibrous septum and it runs along the interventricular septum. It gives off a left bundle branch at the top of the interventricular septum itself, and it continues as the right bundle branch. Left bundle branch is thicker than the right, and it is again divided into anterior as well as posterior fascicle. The branches and the fascicles run subendocardially down on either side of the septum towards the apex of the heart, and then it returns to the ventricular wall to the base of the heart. So we can see here that the branches and the fascicles, they run subendocardially down either side of the septum towards the apex of the heart, and when it reaches the apex of the heart, it turns back through the ventricular wall to the base of the heart. This is the apex of the heart and this is the base of the heart. Next, about the Purkinje fibers. The bundle branches subdivide to form the Purkinje fibers, which pierce the myocardium, and they have the maximum conduction velocity of 4 meters per second. They are very large fibers having large number of gap junctions, and this allows the almost immediate transmission of cardiac impulse throughout our ventricular muscle. The synchronized type of contraction by these two ventricles help in the effective pumping of the heart. Next, about the rate of impulse generation. We all know that SA node, it is the pacemaker of the heart and has the maximum rate of impulse production of 70 to 80 per minute. Whereas the AV node, the rate of impulse production is 40 to 60 per minute, and in the bundle of His and Purkinje fibers, it is 15 to 40 per minute. Next, about the conduction velocity. In SA node and AV node, it is 0.05 meter per second, whereas the atrial pathways, bundle of His and ventricular muscle have a conduction velocity of 1 meter per second, and in the Purkinje fibers, it is about 4 meter per second. Next, about the origin of the cardiac impulse. You have to mention the origin or the ionic basis of the pre-potential or pacemaker potential in the SA node. We all know that they are actually initiate the repetitive action potential. That is, the pre-potential or the pacemaker potential in the SA node usually initiate repetitive action potential. And one of the peculiarity of the SA node is that here the sodium channels is absent. That is the reason why the membrane potential rises only slowly. You can see here the slow rise of the membrane potential because the sodium channels are absent here. And after that, there occurs a rapid rise because of the activation of the voltage gated calcium channels. And there are two types of channels in the SA node, that is T type as well as L type. T type means transient opening calcium channels, where L type is long opening calcium channels. Now, about the ionic basis of the pacemaker potential. So this is the repolarization phase. The repolarization phase is because of the potassium efflux. That is opening of the potassium channels and potassium will be pumped out of the membrane. And this phase, this is the prepotential. Again, the initial first part of the prepotential, it is because of the IK decay. IK decay means just the decrease in this potassium efflux which is happened in the repolarization phase. And the opening of the P type, that is transient type of the calcium channels, completes the prepotential, and the opening of the L type calcium channel produces the cardiac impulse. So that is about the ionic basis of the pacemaker potential and the origin of the cardiac impulse. Now we will see how this originated cardiac impulse from the SA node is spread. So first we will see the spread of excitation in the atria. So action potential originating in the SA node travel outwards into the atrial fibers at a rate of 0.3 meter per second. But the rapid conduction through the internodal pathways, that is 1 meter per second, causes the simultaneous depolarization of both the atria. And the atrial depolarization will get complete within 0.1 second. Then the conduction through the AV node. So I have already mentioned what is AV nodal delay, what are the causes and significance. So please refer the initial part of this video for the causes and significance of the AV nodal delay. Next, about the spread of the excitation of the through the ventricles. Now, after the delay in conduction through the AV node, the impulse from the SA node reaches the ventricles, and the cardiac impulse spread into the ventricles through the bundle of His. One-way conduction through the bundle of His prevents the re-entry of the cardiac impulse by this route from ventricles back to the atria. The impulse first reaches the left side of the interventricular septum. Then it moves to the right across the mid portion of the interventricular septum. So, impulse first reaches the left side of the interventricular septum and moves to the right across the mid portion of the interventricular septum and spreads down the septum to the apex of the heart. So, from the right portion of the septum, it will spread down the septum to the apex of the heart. Now, the wave of depolarization runs along the ventricular wall to the base of the heart. This is the apex and this is the base. So, wave of depolarization first will run to the apex of the heart, and from there it will spread to the base of the heart. And the direction of the impulse usually proceeds from the endocardium to the epicardium. And the last portions to be depolarized are: 1. The posterobasal part of the left ventricle, the pulmonary corners, and the upper portion of the interventricular septum. And the entire ventricular myocardium get depolarized in 0.08 to 0.1 second. And next, about the repolarization, it occurs in the same sequence in the atria, but in ventricular wall, the direction of repolarization is from the epicardium to endocardium. And in the last part, you have to write the applied physiology. That is, your answer in the conductive system should end with the applied physiology, where you can include the abnormal pacemakers and conduction defects like heart breaks. Thank you for your patient listening, and keep on watching Physio Exam Buddy, which makes your physiology exams more easier.